This is Lance Lichter for AA Today. The 20 most important publications that are significant game changers for anesthesiology. Many might think that history is boring. Specifically with regard to anesthesia, who cares what happened 50 years ago? For anesthesiologists, the history of anesthesia is important in part because it allows us to better understand from where we have come so that we have a better understanding of why it is that we do what we do. What we learn is that lessons of the past have not been forgotten. In this issue of Anesthesia and Analgesia, the authors compiled a final list of 20 of the most important publications that are significant game changers for our field. This list is contained in the article titled Game Changers, the 20 most important anesthesia articles ever published. The articles are listed in the summary itself with links if links are available. We encourage readers to read the article in its entirety for a more complete description of each article selected as one of the 20 most important publications. Readers might also note that most of the articles are contained in either the New England Journal of Medicine or JAMA. It's true that for many of the older articles there were no specialty anesthesiology journals. Anesthesiology, however, is part of general medicine, and to keep up to date with anesthesiology, we should not only read journals that contain the words anesthesia or anesthesiology in their titles. Do you agree with the author's selection of publications? Here's the list. 1. Insensibility during surgical operations produced by inhalation. 2. On the use of cocaine for producing anesthesia on the eye. 3. On routine determinations of arterial tension in operating room and clinic. 4. Grading of patients for surgical procedures. 5. 3 articles, Clinical observations on the introduction of tracheal tubes by the mouth instead of performing tracheotomy or laryngotomy, the technique of insertion of intratracheal insufflation tubes, and a new intratracheal catheter. 6. On a new method of treating neuralgia by the direct application of opioids to the painful points. 7. Notes on the employment of the inhalation of sulfuric ether in the practice of midwifery. 8. Pain and its effects in the human neonate and fetus. 9. Ethics and clinical research. 10. Standards for patient monitoring during anesthesia at Harvard Medical School. 11. The relation of anesthesiology to medical education. 12. Effect of nitrous oxide and of narcotic premedication on the alveolar concentration of halothane required for anesthesia. 13. The use of curare in general anesthesia. 14. Pain relief by intrathecally applied morphine in man. 15. Treatment of severe cases of respiratory paralysis by the Engstrom universal respirator. 16. Electrodes for blood PO2 and PCO2 determination. 17. Ventilation and circulation with closed-chest cardiac massage in man. 18. Cardiovascular response to large doses of intravenous morphine in man. 19. Neuroanesthesia. 20. The Surgery Center, an innovation in the delivery and cost of medical care. For links and more, go to aatoday.org. That's AA2day.org. This is Lance Lichter.